Keith Olbermann and Rachel Maddow.
We begin with high-stakes negotiations going on tonight inside the building that is over my shoulder, the U.S. Capitol back there. A small, exclusive team of negotiators gathered behind closed doors attempting to hammer out the Senate version of the biggest change in American domestic policy since at least the Beatles, maybe even since the days of Shirley Temple and Cole Porter. Democrats in the White House have to make two Senate bills into one, which then needs to pass the Senate, which then needs to be brought to terms with what passes the House. They've still got a ways to go, in other words. But negotiations now are about what exactly Democrats want reform to be like. The opposition to health reform appears to have gone mostly silent, or at least mostly wildly off message. Take Senator Jon Kyl of Arizona.
Here's a couple of sick puppies.
This weekend parried a question about Americans not having health insurance by saying this.
I'm not sure that it's a fact that more and more people die because they don't have health insurance, but because they don't have health insurance, the care is not delivered in the best and most efficient way.
Actually, it is a fact that people die because of a lack of health insurance. Just last month, Harvard Medical School researchers published a landmark study of the correlation between not having insurance and dying. If you control for factors like education and income and obesity and drinking and smoking, what makes the difference in death rates among Americans? Health insurance. You're 40% more likely to die if you do not have health insurance, all other things being equal. Statistically speaking, you can blame 45,000 deaths a year in America on people not having health insurance.
I'm not sure that it's a fact that more and more people die because they don't have health insurance.
Senator Kyl grounds out to shortstop. Now, the chairman of the Republican Party, Michael Steele, then
here's a couple of sick puppies.
Said in an interview with Univision over the weekend, quote, "I don't think we need a comprehensive overhaul of our healthcare system." Now, nothing was lost in translation there, even though this was Univision. Mr. Steele was speaking English. His answers were just translated into Spanish, and his words verbatim were, "I don't think we need a comprehensive overhaul of our healthcare system." For all the myriad messages Republicans have tried against health reform this year, there's a reason they haven't gone with "everything's fine, leave health care alone." Mr. Steele strikes out swinging. Well, as the Republican opposition to health reform falters, the other factor to consider is what's happening outside the Republican Party in the conservative movement and in the conservative movement media. You may recall the anti-health reform activist doctor who mass emailed this horrendous image of President Obama as a witch doctor with a bone through his nose.
Here's a couple of sick puppies.
Who's also somehow a communist witch doctor with the hammer and sickle there. The activist who emailed around that racist image was a Florida doctor named David McCaleb. After Talking Points memo publicized Dr. McCaleb's circulation of that witch doctor thing, Dr. McCaleb publicly apologized, and he said at the time that he was going to withdraw from the debate over health reform. He's now back. He's now back on the Fox News channel, being cited by them as an expert on health reform. Republican Party chairman says health care is fine the way it is. Senator Jon Kyl of Arizona says health insurance is frankly just overrated. And the Fox News channel is hosting expert commentary on health reform from the president has a bone through his nose racist witch doctor email guy.
Here's a couple of sick puppies.
Ground out, strike out, knock yourself out. If this is the opposition, the chances for health reform have, from this vantage point at least, never looked better.